The other part of the practice is, which is when people start developing what we're calling the dysfunctional lens syndrome. Dysfunctional lens syndrome is kind of a new term that we're using now, but if you take people that are in their 40s, something happens to their lens and they can no longer focus up close. But that's stage one of the dysfunctional lens. There's a second one that really happens in our 50s where the lens starts getting denser. It turns a little bit yellow. We call it nuclear sclerosis, but to the patient, their quality of vision is going down, and this easily picks that up, that they're coming in and they're not just having problems with the first stage of losing their near vision from presbyopia or lack of accommodation, that they move to stage 2, and now they're starting to have some vision quality of it, and stage 3 is a cataract. In my practice, hardly everybody ever gets a cataract because we replace their lens when they get to stage 2 of the dysfunctional lens syndrome. So what that does is, say if I have a 50-year-old patient who comes in, wants to see better, I'm going to do HD analyzer and tell me, do I go the corneal laser route or do I replace their lens? So this is really valuable on that. And a lot of times if somebody's coming in thinking they're going to have LASIK surgery and I tell them they need their lens replaced, it isn't like they're going to have it done tomorrow. This is a whole new educational thing, but I can show them objectively, this is the reason why I'm suggesting this. And then, since lenses keep getting worse, maybe I'll see that patient a year later. We'll do their HD, now it got worse. They said, okay, I don't want to watch this train going down the hill. I want my lens replaced. And we've objectively documented that their lens is getting worse. So it's been really helpful in providing better care to patients to be able to tell us what procedure to do and when to do it. And there's a lot of trust factor that's developed that this machine's kind of helping us make that decision. Because before we just kind of look at their eyes and say, your lens is going bad. And they kind of say, well, you know, I don't have a cataract, do I? No, you don't have a cataract, but you're going to get one someday. This one gives us a good objective reading to kind of explain that to them.